Sawa.
Na uko smart, unaonekana smart uko nje. Kuna messages watu wametuma hapa. Well, welcome to Medicwise TV once more again. This Sunday afternoon, we are privileged to have a Genesee guest in the house. And you know, when Genesee guests come, it is hot, it is fire. Keep it here as we go live in Medicwise TV. And remember to subscribe to our YouTube page to give us your support, and also remember to holler to our guests through sending your text. On your screen there will be a WhatsApp number in which you can send your text. You can also comment on YouTube as we begin this show. So today we have a special guest, a radiographer by profession, a passionate radiographer practicing in this country, and she is here to give her views about the profession and even matters outside the profession about her career and her life generally. So we welcome you, Madam Komen Mercy. Can you please introduce yourself to the audience? We don't assume that everyone knows you.
Okay. Good evening, and thank you so much for this opportunity. My name is Mercy Jepto Komen. I'm a radiosonographer at Skin Imaging Center, which is located at Moya Town, at Lake Coil Petrol Station. And I'm an alumni of Jomo Kenyatta University, class of 2021. I graduated at the year 2021, and is when I acquired my license. Yeah.
Wow, very short, brief and precise introduction. Watu wa Mwea mmesikia, watu wa Kirinyaga County, your person is in the house. So don't forget to give her your comments after this show. So Mercy, you say you qualified in 2021?
Yes.
So can you take us through your journey in joining radiography? What inspired you to join the radiography profession, and how has it been so far?
All right. Okay. I can say first of all, I didn't know about radiography, so I can say I knew it through later on in my studies. So I was interested in pursuing medicine. So my interest was in health. I grew up with parents who were all medics. My father was a medic, my mom was a medic. Growing up with them, I used to admire how my mom could tell me how she helped her patients, how my dad talked about how people recovered. So I developed that passion from a younger age. So it got into my mind that one time, I'll be working in the medical field. So though I didn't qualify to do medicine and surgery, I got a chance to pursue radiography in JKUAT, but I was still second guessing. So I went to I was admitted, but I was half-heartedly doing the career until I met one of our professors, one of our lecturers at Jomo Kenyatta. His name is Anthony Mamati. So he took me through the profession. He talked about radiography, and then it made me enlightened about it. I was happy, and I got interested in the profession, in that radiography is it's like the eye of medicine, whereby we see what is unseen. Other doctors can't see what we see. So But so far so good. I can't regret. I'm happy about it, and the opportunities that have given me so far so good. So I am pleased to be a radiographer. I'm proud to be one radiographer.
Here is Mercy, who his aspirations were to become a medical doctor, and now he didn't get a chance to become a medical doctor. You landed in radiography.
Yes.
What is it that you feel, even if you lost the chance to go to medical school and study medicine, what is it that you feel from inside you don't regret?
Okay, first of all, I pride in myself. I pride myself in the fact that I can be able to diagnose a patient and tell the patient what's next. For instance, when you do, maybe I can do an abdominal ultrasound, a patient will come complain of severe abdominal pain. On doing a scan, you can find the patient has maybe hepatic steatosis, a patient has gallstones. So with that, I can be able to see through the eyes, not my eyes. So it's like the window to medicine.
Yes.
So
yes.
you can see through the patients, and I can advise the patient.
Yeah.
At the same time, I pride myself with taking this career because it has very great opportunities. You can also have your own facility. I can open my own radiology center. Then I can employ other people.
Take me through your experience. So where were you in college, or where did you study your radiography course?
Okay, I am an alumni of Jomo Kenyatta University of Agriculture and Technology. It's in Juja, main campus.
Yes.
Yeah.
And you qualified in 2021?
Yes.
So how has it been in terms of experience? You know,
Okay.
you are now like 4 years in practice,
sure.
having have qualified in 2021.
Mm-hmm.
Do you think you have grown in terms of how you started with the experience and now in your practice?
Yeah, so far so good. I can't compare myself to where I was 5 years ago or 4 years ago. At first, I started as an intern or just a volunteer at a German medical center, which gave me the ground experience,
Yes,
where
yes.
I could be able to do a variety of imaging modalities ranging from X-rays, CT scans, ultrasounds, and special exams. Then from there, I got my first employment at Precise Diagnostic Imaging, which is at Fifth Avenue. From then, I gained, I could do locums at different facilities. So my experience as per now is much. So I feel I'm an experienced radiographer. Right now, I'm practicing at a full house radiology facility at Mwe, which is the one of the best diagnostic center. It's called Keen Imaging Center. Keen Imaging Center has a variety of imaging modalities, and I'm actually the head of clinicals there. So we do a variety of exams ranging from X-rays, ultrasound, CT scans to special exams, HSG examinations, MCUs, barium swallow, barium meal, echo, cardiography, and ECG. So in case of you are at Mwe and you need any of those radiology services, feel free to visit Keen Imaging Center located at Lake Oil Petrol Station.
Wow. Now, listening to you, I feel the other time we have had radiographers in this show.
Yeah.
And most of them have said they have specialized maybe in fetal ultrasound, or another says he has strength in echocardiography. Another one says he has strength in CT or MRI. So listening to you, are you all around? You are not specific in a certain area of radiography which you are passionate in?
Okay, I can say so far so good. I'm an all-round radiography, but I'm more. Okay, there is one thing that you'll be, of course, interested in so much, of something that you love even doing. Even if you close your eyes, you can do it. So I'm a sonographer, but I can do good CT scans, good X-rays, and also MRIs. But right now, I do most is ultrasounds.
Let's change gear a bit and let's discuss about patient care.
Yes.
And you know, when you are practicing, there comes patients who are down and they feel frustrated due to their diseases. How do you go around with your patient care? How do you make sure that in patient care you maximize to your patients? And maybe you can tell us any patient care challenge you have ever faced in your practice.
Okay. For those kind of patients, we usually communicate to them. So you can call them aside to maybe a private room, talk to them about their condition. You tell them that they are not the first ones. You've had other patients who have had those kinds of diseases or those kinds of pathologies they are battling, and they have already recovered. And you can also empathize with them. You show them that you understand that they are going through something and they will be fine. You can also offer support to them. Like you can give them a place where they can rest. You can give them maybe some beverage, talk to them. Yeah.
So you have never faced any challenge in caring for your patients?
Yes, we have a lot of challenges, of course.
Any challenge you can cite to our viewers? Okay,
the challenge we usually face in a radiology department is unconvinced patients. Patients who don't they are not convinced about the diagnosis you give them.
Yes.
So maybe, okay, and sadly or unfortunately, is those patients, they are not convinced when the exam is unremarkable, which is when the exam is normal. For instance, you come to a facility, you complain of chest pains, but when you do X-ray, the chest appears normal. So the patient will be like, why am I having chest pains and it is normal? So to that patient, you explain to them, yes, you might be having chest pain, maybe it could be other reason, but it has not affected your chest. So we are just surprised that people want to be sick. They don't want, they are more concerned on the money they used to spend on doing the X-ray. They are not happy that the result is normal. Yeah.
Okay.
So for those patients, you can try to talk to them. If they feel like they are not convinced, you can suggest for a second opinion. They can go somewhere else and do another repeat.
Wow. So good. In this show, we always don't quit before we discuss about AI technology in practice. So maybe tell us something in your practice. Has AI impacted your practice? Have you seen AI being applied in workplace?
Yes, I can say AI can be, yes it is, because it has a lot of advantages. I can mention but a few.
Yes.
For instance, it has increased diagnostic speed, in that AI can easily flag pathologies. So instead of radiologists taking time to go through the images and getting a pathology, AI can just automatically cite a pathology. So it has increased diagnostic speed. Another one, it has helped to reduce burnouts, of course. So instead of taking your time and reading many reports, AI has made work easier by sampling but a few. Sampling more, I mean. And also, it has also enhanced patient care in that it can easily detect emergencies like brain bleeds in CTs, so that we can take necessary action in case of emergencies. So I can say AI has been beneficial. Yeah.
Do you see AI replacing, most professionals, most radiographers are threatened that AI is going to replace them in practice? What is your opinion on this one?
Okay. According to me, AI can never replace radiography. Instead, the AI is there to augment our skills. AI is just there to augment the radiographer skills, because AI cannot do some tasks like it cannot lift a patient to an X-ray table to perform the exam. At the same time, it cannot calm a claustrophobic patient in an MRI machine. Another one, AI cannot adhere to radiation safety. AI can just suggest a scan protocol, but it is the duty of a radiographer to check if it is clinically, the protocol is clinically approved for the patient. So AI cannot, it cannot replace, because we believe in a medical field, any upcoming technology is just there to challenge, but not to replace. When CT scan was invented, we thought that this will kill the X-ray, but it has not killed it. Actually, it has provided a wider opportunity. Like, you can do something in X-ray, but if you can't see it, you recommend a CT scan. And then maybe there are other algorithms in AI AI can miss other algorithms. So it is just the duty of a radiographer to be super smart so that you always become irreplaceable. So what I can say is that AI cannot replace radiography. Maybe radiographers with AI intelligence can replace radiographers without the AI intelligence.
Wow, good explanations there on AI. Let's go back to your personal career. Where do you see your career in the near future? What do you want to pursue in radiography more and be able to practice more in your own point of view, career progression? What do you want to pursue? Where do we see mass in future, in the near future?
Okay, that's a good
Career-wise.
question. As for me, I really love my career, and I'm not going to pursue outside it, but rather I'm going to, my main, in the next 5 years, I see myself having my own facility.
Okay.
Being self-employed, having my own ultrasound, having my own X-ray and CT scan, being the boss now. I've already practiced all these years. I want now to be the boss, have my own facility, not being employed. Maybe in the next few years.
So you are looking forward to
self-employment,
and
owning my
entrepreneurship and investment in radiology?
Yes.
Wow, then you need to meet people like Mohammed, people like someone who was here, Gidinch, those people who have private practice, and many more are in the field, so that they can be able to mentor you to achieve that dream of having your own, being your own boss.
Yes.
That is very good to hear. And in your aspirations to become your own boss, what do you see as challenges which are delaying the dream? Because I know if you had maybe power, it would have started even yesterday.
Okay, of course, challenges are, first of all, maybe is citing a good site and then getting influencers who can guide you properly, or maybe financial constraints. Because for you to have your own facility, you need a lot of capital. So, and again, you need advice from people already who own their own facilities. Yes, so that could be a challenge. But I believe and hope in the near future I'm going to tackle with that challenge.
Wow. So we continue with our conversations. This is Dida, the X-ray man. This is Medicwise TV. We blind in bringing you this kind of conversations now and again. And the show is becoming bigger and bigger through your support all along. So maybe before we go to a short break, I will give you maybe something to tell us other than practicing radiography. What is your hobby? You know, when you are not practicing radiography, what do you engage yourself as your hobby?
Okay, on my free days or on the days I'm not working, okay, I love cooking, and okay, I love cooking. The other end, I love knitting.
Knitting is still cooking?
Knitting, can I explain it in Kiswahili?
Explain it in Kiswahili.
Knitting ni kushona.
People are wondering what is knitting.
Ni kushona,
Oh, knitting kushona. You are a fashion designer?
Yes. And I also am a makeup artist as well. So on my free days, I usually book clients to do their makeup. Yeah.
Okay, viewers, we don't take it for granted that you keep supporting this show through your viewership. And remember, this is Dida, the X-Ray Man show. And this show is sponsored by RadMed Connect, supplier and supplier of medical equipment, especially radiology equipment, X-ray and ultrasound. When you have a chance, please remember to support us. For now, we are going for a short commercial break, and when we come back, our guest is going to show us some dancing moves as we finish the show, because she says she has talent in dancing also.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines. We have it all. At RadMed, we are dedicated.
Well, welcome back to Medicwise TV. I'm your host, Didakus Mochache, aka Dida the X-ray man. And in studio, we continue our discussions with our guest, Mercy Komen, radiographer practicing from Kirinyaga County, Keen Imaging Center. She's here to shed light on the radiography profession and her practice and how she's navigating career-wise in terms of practice. So just before we went for break, we were discussing about, we wanted to discuss about job market. I can classify you as a Gen Z. And what we always see and hear is that the Gen Zs are complaining. The jobs are not there. The salaries are being underpaid. What is your advice in the field out there? What do you think are the challenges happening?
Okay, about the job markets going down, people are unemployed. It means that many people are pursuing now the profession. So people have to be more vigilant and okay, well, it means that the job market is down. So you have to be more vigilant and go and look for the job. You can't just sit there and say that I've applied and I can't get the job. Visit the offices, visit those facilities that have imaging centers and go and ask for a job. Just don't say that we don't have the jobs are not there, facilities are not paying. Yes, about payment, there are facilities which are not paying, but it is your duty as a radiographer or a duty as a staff to talk to your employer. So that should not be an issue to the profession. It is the issue about the facility, but I can say the job market, still it's good. It's people are just being lazy, I can say. The facilities there are many imaging facilities. The facilities that offer ultrasound are more even nowadays. So I think what job market is about you to be vigilant and you to walk around and do the hard work. People just want to concentrate in Nairobi. There are many facilities outside Nairobi, which have many good imaging machines. So if you just concentrate and say you want to work in Nairobi, is where now you'll find that there is a challenge in getting employed. So be comfortable in working anywhere at the moment. Just don't specify here in Nairobi. That's my view.
So according to you, you feel that
It's
the
not yet
young
crowded.
people are not outgoing,
Yes.
they are not doing enough, they are working so hard to achieve this. So, okay, fine. Again, in the profession of radiography, we have Society of Radiography in Kenya. And there is a lot of apathy from young professional radiographers in joining the Society of Radiography in Kenya. Why do you think is this the case? Why do you think most people don't want to be members of the Society of Radiography in Kenya?
Maybe due to the propaganda that there was an issue some other time about licensing and the price being hiked. So the licensing price is going high, and people are believing that there's propaganda from SOC, so they are trying to discredit the old SOC, maybe to create another board. I think so. I think that is the main reason, challenge, and yeah, I think that's the main challenge.
So, as we wind up this interview, maybe I should give you time to, what kind of advice generally can you give to young radiographers who are coming behind you in the field? What kind of advice can you give them?
Okay, I would like to advise the young radiographers pursuing the profession to be more patient with their career, and to also make sure that they do their daily clinicals, because without your practicals, radiography is nothing without practicals. You can be good at theory, but without the practical part, you will not be good. So just be doing volunteer in hospitals, do your locums, make sure you're up to date with AI algorithms. At the same time, make sure you join as far as people are discouraging about SOC, make sure you become a member of the Society of Radiography, so that you can network, meet other radiographers, and also get job connection and also advice. So you are on the right track. Radiography is a very beautiful profession. It is actually it's like the eye of medicine. So without radiography, doctors will just be guessing or doing guesswork. Without radiography, you can't know that a patient has a fracture. Without radiography, you can't know that a patient is battling stage 4 cancer. So let's give radiography the respect that it deserves. Let's give it the seriousness that it deserves. You are in the right track. Keep pushing, keep being hopeful, and yeah, that's all.
I know most of your friends are listening to you or are watching you. You can pass regards to some of your friends who are watching you in this show, and watumie salamu zako.
Okay, first of all, I would like to say hi to my colleagues. I know they are watching me. I know you've been watching, and they have also been asking. You've not yet started, so I would like to pass my regards or greetings to Penina and Caro. They are my colleagues. I also like to pass my regards to my best friend, a radiographer, Victoria Mukuria. She works at Bliss Healthcare at Embu. I would like to encourage her to be also part of the show. And also my sister, Beverly Chemutai. I would like to say hi. And all those watching the show, thank you so much for your time.
Thank you so much, viewers, for being here. We don't take it for granted that you take your time to support and view and watch our shows here at Medicwise TV. We shall continue advancing our aim of bringing you this kind of discussions now and again. Remember, at Medicwise TV and in the DIDA, the X-Ray Man show, our aim is to inspire, educate, and inform. And this is the haven of healthcare conversations. See you next time in another show. And we say bye-bye for now. And thank you for supporting us.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionising healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Centre. Jabs Medical Centre. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray